everyone. Today we have a very special guest with us in the studio. I would like to welcome Dr. R.N. Kalra, physician and cardiologist at Kalra Hospitals, directors and CEO. Welcome, sir. Thank you so much for coming here.
Thank you very much.
I know it is very difficult for you to take time, so thanks a lot.
Thank you.
I would like to ask you a few questions here so that we can help our audiences.
Welcome. You're welcome.
I would like to ask you about the sleep disorders, or we call it as OSA.
It is called obstructive sleep apnea. Means it is sleep disorder in which a person is not able to sleep at night. He often wakes up, the respiration, the breathing stops for a few seconds, and he has gabrat and gets up. Okay, what is happening?
Okay.
Maybe there is a loss of less oxygen, and this episode is repeatedly happening at night.
Okay.
And in the daytime, he usually tries to sleep to complete the sleeping hours. Now the person is sleeping at daytime, maybe he's writing, maybe he's driving. It is a very dangerous thing.
Exactly.
So this is called sleep disorder. It usually can happen in the childhood also, when the children have enlarged adenoids and tonsils. And the persons who are obese, who don't do exercises, who are overweight, those persons who have high blood pressure, those persons who take a lot of alcohol, this is very common in these people, and they are not able to sleep at night. They wake up oftenly, and their oxygen falls at night because the tongue falls back in the throat, and they are not able to they take the breath, and they get breathlessness. They get up, they get up with very gabrat, and what is happening, and then they again go to sleep.
Exactly.
And the daytime they sleep. So this is called sleep apnea.
Okay, thanks a lot for the information, sir. Also, I would like to ask you, what are the symptoms of sleep apnea, if you'd like to tell?
The symptoms, as I told you, the person is not able to sleep properly at night, and he often gets up with gabrat, wanting breath, and maybe he goes out to the room to take the breath. He takes few breaths, sits up, again sleeps, again it happens. So this, if repeated, happens, then it can be dangerous for the life also.
Exactly. Thanks a lot for answering that. I would like to ask you, what is the treatment, if we talk about the treatment?
If a child has sleep disorder, he has to show to the pediatrician and check his throat. Maybe he has adenoids, maybe he has tonsils, which has to be operated or treated by the medicine. Those persons who are obese, they have to reduce their weight. Those who are high BP, high blood pressure, they have to control their blood pressure. And the person should go for a morning regular walk. Now at home, what you can do? Try to do the exercise of the tongue. You can do like this, one or the other side. You can take this, close the nostril, take breath from one side, exhale and take from the other side. You can do yawning.
Okay.
See, yawning is a natural phenomenon.
Yes.
But you can do artificial yawning.
Yeah.
जैसे उबासी नहीं लेते हैं, ऐसा आप कर सकते हैं. These things can help you at home.
Okay.
No, the permanent treatment is, if the episodes are more frequent at night and can be dangerous, then one has to go for the CPAP.
Okay.
It is a small machine. It is continuous positive pressure ventilation. Do you put it at night? The air goes with the force in the throat. The throat opens, the tongue does fall back, and you are able to take the breath, and you are able to sleep at night.
Okay.
This is called CPAP. So CPAP is the only treatment, best treatment, non-surgical treatment for the sleep apnea.
Exactly.
And those persons who want to go for surgery, there are a lot of surgeries available now. There is a 12th nerve which can be taken up for surgery, or the other is UPPP. There is a long surgery. There is a plastic surgery, and which can help in this sleep apnea.
Also, I want to ask one question. Can sleep apnea be a reason for underlying diseases?
Yes, it can lead to hypertension, high blood pressure.
Okay.
And it can lead to accidents in the morning.
Okay.
Suppose you are driving into sleep, you can pay to the accident. You can you can have the accidents, and you are not able to work in the daytime.
Okay.
You are not able to concentrate in the daytime. These are things.
Is it also linked to some mental disorders? Because if somebody is not able to sleep properly, is it also seen in the patients that they're also suffering from particular?
There are a lot of reasons you are not able to sleep. Suppose the heart pump is weak.
Okay.
And when you lie down, the fluid comes in the lungs and you get up.
Yes.
By the gravity, the fluid goes down in the lungs and you feel better. And again lie down. This is called heart failure.
Okay.
So one can have the sleep disorder due to heart failure also, but this is not sleep apnea.
Okay.
In sleep apnea, these things don't happen. There's no
Okay.
fluid in the lungs.
Okay.
The tongue falls back and you're not able to take the breath.
Okay.
So this is sleep apnea. And secondly, those persons who are asthmatic, they can have this sleep disorder.
Exactly.
They get breathless at night. The person who are very obese,
Yes.
they can keep on turning on the one on the other side. So there are a lot of other diseases which can lead to sleep disorder.
Sleep disorder. Exactly.
But this is OSA is different from all these disorders.
All this. So OSA is a specific disorder of
Yes,
sleep.
yes. It is very common nowadays. It is
Okay.
very commonly happening nowadays. Because people take a lot of alcohol
Okay.
and they keep on tossing in the bed. They are not able to sleep. They are obese. And I told you the reasons just a few minutes back. So it has to be treated.
Treated.
And if the person applies the CPAP, there is very small equipment.
Okay.
Your life becomes comfortable.
Okay. So, in conclusion, can we say that changing in lifestyle, and because of the lifestyle that people are having these days, is it also a reason that is contributing to OSA?
Yeah. Having a lot of alcohol.
Yeah.
Getting late in the morning, not going for the walk.
Yes.
And you become obese, you take, you are hypertensive, your cholesterol is very high.
Yeah.
A lot of things.
Okay. Thank you so much, Dr.
So this
Kalra.
disorder is curable and treatable. This I want to say.
Okay. So people don't have
So
to.
one has to go for the sleep study to diagnose the test.
Okay.
If your sleep study shows that your AHI, apnea index is very high, then one has to go with the CPAP level.
Okay. Okay. So people don't have to be scared of something like.
No, it is a treatable and curable, but one has to be very careful and control the diet, go for a walk,
Okay.
don't take a lot of alcohol, and if your sleep study is abnormal, go for the CPAP.
CPAP, exactly. So all the audiences who are like, feeling this sleep disorders and everything, Dr. Kalra is here and he is suggesting that he should or she should get checked specially, and it is curable and treatable. Thank you so much, Dr. Kalra, for
Thank you.
taking time for us and educating us and our audience about this
I think you must
OSA.
have heard for the first time.
Yeah, exactly. Because sleep disorder is such a generalized term that we
Normally
use.
people keep on high BP, diabetes,
Exactly.
heart attacks. It is a different topic.
Exactly.
People should know about it. What is
Exactly.
happening.
Because I think more people are facing QSA and it is very general, but people are not educated enough.
This disorder is usually missed,
Missed, exactly.
right?
Thank you so much. Thanks
you.
a lot for coming here and educating us.
Thank you.
Thank you for helping our audiences and us as well.
Thank you very much.
Thank you so much, sir.
Thanks a
Thanks a
lot.
lot.